All right, welcome everyone back to another session this week with
Sorry,
Dr.
everyone. We have Reese with us as well. So that's Reese that's barking, and he's already getting the party started.
Yeah, already introducing himself, which is great, I'm sure that you'll be talking more about him later on in this presentation, but I'm very excited for this session. It's about oral medicine with Dr. Rigert. She has formal training in both dentistry and medicine. So we have a lot of pre-med students for sure, a lot of pre-dental students who are also joining us. This is going to be very interesting for both ends, both spectrums. I do have a few reminders, especially if you're new to virtual shadowing. So towards the end of each of these sessions, we have a Q&A. If you have any questions for our speakers, including for today and also any future sessions, feel free to type them in the chat. Dr. Rigert will be happy to get to them and answer them. And we'll go through them in the order that we receive them. So if you have any questions, be sure to type them as soon as you can, just so that hopefully we'll be able to cover them. This is going to be an hour-long session. We'll use any remaining time that we have after this presentation for the Q&A. Also, if you want to stay tuned with other shadowing sessions, we have them on a Monday and Thursday basis, usually. Sometimes times do vary, but it's usually Mondays and Thursdays at 7 p.m. Central. Follow us on Instagram. We're going to be posting flyers like you probably saw for Dr. Rigert and other speakers over dentistry, medicine. We have some PA speakers, some nurse practitioners who joined us in the past. So a really good, healthy mix of healthcare professionals on board with us to speak. Also, another way of staying tuned is our email listserv. So to join that email listserv, it's a weekly email. Same thing, we publish or we post those flyers weekly on Tuesdays usually. And to join that, you can either send us an email at shadowing.h, the number 4h at gmail.com, asking to be added to the listserv. Just include your name and your email, preferably a personal email, a Gmail, a Yahoo account. Or you can go onto our site, scroll to the very bottom, and fill out our subscription form. Either of those ways will get you on the listserv. And like I said, it's a great way to stay in tune with us. We not only have a shouting program, but we have a few other programs also that have some application cycles, and we update people on those, both on Instagram and our listserv. So definitely more than just shadowing that we also offer. But with that said, I don't want to take much more time. Dr. Rigert, feel free to take it away.
Well, thank you so much, Michael. I love all the resources that you're created. And as you can see from my screen here, I'm going to be a mix of professional. And of course, Reese has already introduced himself as a little bit of goofy, and that's on purpose. And I think the important aspect of my presentation will be to remember that you are more than just your profession, because I will be talking about my original career path. I was in the Air Force on a fast track to be an oral maxillofacial surgeon. And career pivoting has been a very big challenge and a very big aspect of my story. And I really want to share that part so that you all know where you can find support, so you find yourself on a path that may not feel right for you at some point in your life. But for today, our main focus will be on oral medicine, but I will give you a little bit more about my background. So there you have my permission to pivot. And of course, what is oral medicine? This is something that I think people often, when they meet me, they always then refer, oh, oral maxillofacial surgery. I'm like, yeah, I pivoted from that and I do oral medicine. But oral medicine is a more recent recognized specialty. It's been around for a really long time, but it just got recognized as a specialty. So I'm going to explain a little bit more about that path for you. Disclosures: I have no financial conflicts of interest. This is for educational purposes only. Of course, I brought my adorable puppy. Photos will be included. And if you're not a dog lover, I apologize. You may not be as excited about that other people might. And I have tremendous gratitude for the robust mentorship team. And as you can tell from the amount of people that you're able to meet, I think it's important to meet a diverse group of people who can help you along your journey. I have mentors from different angles who have been so supportive. And I'm currently funded by the NIH and IDCR. And so I want to thank them, of course, and my institution. It's a tremendous institution, but all of your views here presented will be my own. And so my journey in the beginning with the italics is the very fast track that I went on. At Augustana College, I was in a 3-4 program, which meant that I selected my career path when I was a freshman in college. And I was really enthusiastic to do oral maxillofacial surgery and to do dentistry. And the reason why I was interested in psychology and really helping people improve their quality of life. And I saw the face as something we really see our self-worth, our self-value, and that's where our identity is often associated. So I went to Southern Illinois University Dental School in Alton, Illinois, which was I had a tremendous dental education. And when I was there were Air Force oral surgeons and other specialists that came and they rotated through our school. And I was always kind of thought I wanted to join the military. And when I met the Air Force oral surgeons, I'm like, that's my path. I really wanted to do more medicine. And I thought, this is my place. And so when I was selected to be an oral surgery resident for the Air Force, I thought I had finally made it. All this work that I had put in, I had put my head down, I had sacrificed so much, it was finally paying off. And there's a term, it's called the arrival fallacy. And if you haven't heard it, I want you to hear it now, because I want to make sure that you all are living while learning, because we often put our heads down thinking that things will get better when, life will start when, and we put things off for a really long time. And it's often championed that we sacrifice so much. But I want to advise you to please live now while learning, because you just never know what's going to happen. When I was at my residency, it was a fantastic place. It was a good fit for me from an institutional standpoint. But when I was on call, I actually developed suicidal ideation. So if you hear a lot of physician suicides, we don't hear from people necessarily who talk about why or what they were going through when they developed suicidal ideation. And for me, it was forced sleep deprivation. So for periods of prolonged sleep deprivation, I developed suicidal ideation. So when you are thinking about the career path for you, also make sure that the lifestyle works for you, because I could love surgeries all day long, but if I was mentally not well, it was just not a sustainable life decision for me. But it took me 3 years to give myself permission to pivot, which is why you hear me advocate for that earlier. And during that time, I lost people close to me. And my suicidality, I had maladaptive coping skills. So what I mean by that is I developed an eating disorder. I was using that to cope, and that provided me a ticket out the door when it came to the Air Force. And it wasn't something that I wanted, but it ended up being an appropriate path for me to take. So if you think sometimes, here I am where there's that space, is really the identity loss that I provide you to say, don't put all of your identity in your profession, because when it's all stripped away, then what? And so really kind of develop yourself as a person outside of your profession as well. But it all worked out really well, even though I wanted to stay in the Air Force. I love my Air Force experience. So if you're interested in the military, of course, we can always talk about that. I will never tell you what to do, but I'll definitely be a sounding board to hear if you're thinking through all the things you need to in order to investigate that path for yourself. So in that gap, I ended up having a great mentor that said, hey, you should check out oral medicine. I had never heard that it was a specialty. Oral medicine combines dentistry and medicine. And you think, oh my golly gee whiz, it should never have been separated. That's correct. And there is a pathway to try to integrate them. And for anyone here, I strongly advise you to be a champion of bringing dentistry and medicine. And I hear optometry always, when I try to say dentistry, medicine, the optometrists always say, and optometry, bring it back together. And also we need to see the people, bring the human back into the healing. So I went into oral medicine, and I'll fast forward to where I'm at now. I'm a postdoc research fellow in radiation oncology. So I'm going to tell you how oral medicine specialists fit into a multidisciplinary team, particularly radiation oncology. So here is the path I described for you. Very fast-paced, linear trajectory, and then mixed with a lot of twists and turns, but it's been a fun ride throughout. And here's what I recommended to you. Make sure to incorporate some outside interests into your life, and not rely only on your profession for your identity and your interests. So I'm a dog mom, Therese. I'm an endurance runner. I'm a writer and a blogger, and I'm going to provide you with some good blogs. If you haven't heard about them, you probably have, but just in case you haven't, I think they're good places to find community. I'm also going to provide you my YouTube channel community, which is a community of a lot of physicians. I also have my best friend who was 27 years in the Marine. You hear their life lessons. So as while you're listening to say, hey, these are the interests I'm doing from like a case basis, you can also learn the lessons we often learn the hard way. And we share them in hopes that you don't have to learn them the hard way, that you can learn from us. And here are the platforms. There's one, Social Media Docs and Kevin MD. So my sharing of my story after I left surgery, it started on Kevin MD. And that's when I learned that so many people resonated. They were really feeling like they developed a lot of burnout, a lot of depression, some suicidal thoughts, and it's really hard to talk about. And so if you find that platform, you can, search things that might be going through your mind, search interests, and find that community. It's also been a really great place for many of us to start healing. And again, I say burnout, but we also have ways that we're going to improve and give you tools so that you can help reduce your risk for burnout. And part of that is developing outside interests. And there's a lot of systemic things that we're really working to change. So this is my YouTube channel. And funny enough, I invited my dog to be a co-host because I knew he was going to interrupt like he does today. And I'll tell you, that's the first time he's barked all day long. So always proud of my dog Reese for being the interrupter. But this is my YouTube channel. If you want to look into it, of course, there's no pressure, but this is the community where you get to meet a lot of people. You get to hear their life stories. You get to hear what they do, see where you resonate, and see who might be able to help you along your journey. So now finally, the whole point of today's discussion, right? What is oral medicine? So as I mentioned, oral medicine is one of the recognized specialties in dentistry. So you'll start by going to dental school, and then of these 12 options, these are the 12 paths you can take for a specialty. The most recent recognized is oral medicine and oral facial pain. I think we will. In Canada and the ones in the United States. The one that is on the top is the one that I went to, Atrium Health Carolinas Medical Center, and that's in Charlotte, North Carolina. So the information I'm going to provide is from that residency, since that's the one that I know most about in terms of rotations, but you can look at the other ones' websites to see how they compare. I wanted to show you what it could look like for you if you went straight into oral medicine residency. So you go to dental school and then you do oral medicine residency. And oral medicine residencies often start with general practice residency, which is a hospital-based residency program where you're doing dentistry for medically complex patients. Because compared to dental school, you're usually given pretty healthy patients when you're learning dentistry. But then in order to treat a really large population, especially if you're going to go work in a rural setting, you want to know how you can treat all patients. And a lot of patients have medical conditions that you need to be aware of. And then you do the oral medicine residency path. And I'm going to give you a list of the rotations that you might expect from that type of residency. So here are the residency rotations, specifically from the site of my residency program that I went to. You have oral medicine. So you have an oral medicine clinic. You'll also be in a hospital-based dental clinic. And it was a really neat opportunity. I wasn't able to go to Scotland, but my colleagues were, and some of them miss out because of COVID. So COVID pending, if you're able to go and you do the residency at Atrium, I thought it was really awesome that had the opportunity to go to Scotland and learn oral medicine in a different country. And then of course, ENT, so otolaryngology, there's so many overlaps. This is often where if we see somebody who we biopsy, we think this might be cancer, we might refer after we start the biopsy and do a little bit of a sample. We don't want to take a whole lesion that looks like cancer. Therefore, when the patient's seen by ENT, that they know exactly where they're looking and where the rest of their treatment needs to be localized. And then we do oral pathology, oral radiology. These are other specialties of dentistry. Internal medicine is important because oral medicine treats a lot of the oral manifestations of systemic diseases. And then psychiatry, there's a lot of flare-ups from oral lesions that can happen if a person's extremely anxious or stressed. And we know from the stress of COVID, there's been a lot of people that are actually fracturing their teeth from clenching and grinding. Hematology and oncology. So oncology would include medical oncology. So if you're getting chemotherapy, you can actually get oral mucositis and oral lesions from when your blood cell counts drop. Or radiation oncology, which is where I work, and I'm going to dive a little bit deeper into that path today. And then physical therapy. So when you're clenching and grinding, you're like, oh my gosh, my jaw is so sore and I can't even open my jaw. Well, we can send people, if it's more muscular, to physical therapy and really help get the mobility of their jaw back. And then of course, infectious disease, for anything that, is concerning lesions. Sometimes you can get fungal lesions. You're like, what is this? And, you can biopsy and get some support from infectious disease or nephrology and neurology. So we also, oral medicine, we get taught about headaches, and some people can advance their training and focus more on headaches. So trigeminal neuralgia is another oral facial pain, if you've heard of that, and that would be more something that you consider when you think about neurology. So here I have the oral medicine book, and if you open it up and you look at the table of contents, this is what you would find. Of course, we're not going to talk about all of this today. That would be crazy because it's a lot of different things. And I wanted to introduce this to you because my path is pretty niche focused in cancer. But if you're not interested in niche focusing on cancer, I wanted to give you the opportunity to be aware of what else there is out there for oral medicine. So in the beginning, we talk about clinical research. There's benign lesions, then it goes to cancerous lesions, then the oral complications of cancer treatments, salivary gland diseases, then you go into the oral facial pain, the headache disorders, then the oral manifestations of systemic diseases, and so on. So it's very robust. And you can pick your niche according to what your highest interests are and really focus in that way. So what do you do after you graduate from oral medicine residency? It's very common to go and be a faculty member in dental and medical schools. And often part of that component would be being a hospital-based dentist. If you're like me, I did scientific research, and that is my full-time job. I'm a full-time researcher, and part of the scientific research is usually a component of being a faculty member as well. Private practice is an option. Some of my colleagues work in oral surgery private practices, which is a really great way to have colleagues next to you. Therefore, if you are in a case that's kind of borderline, sometimes it's a little bit more complex. It's good to have a person that's a little bit more advanced in their surgical training. And then for oral medicine, we might, if you have a person that comes in with chronic oral lesions, we might manage more of the chronic issues. And then say a person, sometimes a chronic oral lesion would be what's called lichen planus. So it's a patient that has, it's thought to be an autoimmune disorder where you get oral lesions are usually bilateral, but they can develop into cancer. So you got to keep a good eye on them. So an oral medicine specialist might watch them and treat them and help manage symptoms associated with lichen planus. And if it's concerning for cancer, and depending on how large the lesion, then you might tap to your oral surgery colleague and say, can we take a sample of this and go from there and make sure that you're always keeping an eye for anything that can be cancerous, which I'll talk a little bit more about how benign lesions can look and turn out to be cancer. So again, this is a little sample of what I am doing. I want to just provide you the opportunity to understand what's available. So I am funded through an NIDCR diversity supplement, which means that I'm on a diversity supplement. My boss has a bigger project that I'm funded under, and he is a radiation oncologist. My mentorship team is multidisciplinary, and I'm a postdoctoral research fellow in radiation oncology. My primary focus is reducing radiation toxicity to normal tissues to improve patients' quality of life after radiation. The reason I was interested in that is often when patients were coming to me as an oral medicine physician, after they had already gotten radiation, they had such severe side effects that they were suicidal, that they were feeling, I don't want to live like this. It is intolerable. So they were surviving their cancer, but their quality of life was negatively impacted. I'm also going to share oral health consequences of radiation so that you can understand the role of the oral medicine physician and these patients' lives. So again, role of oral medicine physician on the radiation oncology team, and we'll talk about the oral and oropharyngeal cancer. So when I think about oral and oropharyngeal cancer, I think of two separate types of entities. You have HPV negative, which is usually associated with tobacco and alcohol. If a patient drinks while smoking, that actually increases the risk even more for developing cancer because alcohol acts like a solvent and it brings those carcinogens into the tissue. Of course, we want to try to get anyone that's smoking to quit smoking because there's a lot of different cancers that are associated with smoking. HPV positive cancer is actually on the rise. This is a sexually transmitted virus and human papillomavirus. You might hear about it a lot with Gardasil vaccines. These vaccines are targeting or recommended for young people, and we'll talk about why that is a little bit later. But this HPV positive cancers, they usually happen more in the back of the throat compared to HPV negative cancers, which are more visible. The good thing about HPV positive cancers, if we had to make a good thing about them, is the prognosis is usually a lot better, and they are usually sensitive to radiation. So they respond well to radiation. They can usually be cured of their cancer, but then they're left with radiation toxicities. So that's where we need to improve. So also, when we're looking at HPV positive cancer patients, we're looking at pretty healthy individuals. So these are individuals that are going to live a long time after their radiation treatment. And for one patient that really sticks out to me that actually was HPV negative cancer, this person had no risk factors, maybe drank a tiny bit, didn't smoke, healthy otherwise, came in with a non-healing ulcer, lateral border of the tongue. So when we're thinking cancer, we can't just look at a lesion and know. We got to palpate, the borders were firm, and the lesion actually looked really superficial. So if I just looked at it, I was like, oh, there's no way. But the history was this is a non-healing ulcer for more than 2 weeks. So that's a big red flag. And there was nothing that showed any signs of like a fractured tooth that could be causing trauma, that could create this ulcer that's just constantly getting traumatized. And that turned out to be HPV negative cancer. And thankfully, I believe that person was doing quite well. There was a person in residency, and the last time I checked, that person was doing quite well. But for HPV positive cancer, when these people come in, again, like I said, it's people that you say, wow, they're pretty young, they're pretty healthy, and we have to counsel them on what radiation impacts are going to do for the rest of their life. And that's where I want to share with you the big role of what I perceive the oral medicine physician to be on this multidisciplinary team. So if you go to visit the dentist, every time you go, they do oral cancer screening. HPV might not be visible because it's so far in the back, but they might come in with symptoms. So a person, the oral medicine physician could be in help with the diagnostic time period, or this person could have been diagnosed and then sent to the oral medicine physician to do, if they're about to have radiation, a pre-radiation comprehensive treatment exam. So if a person is about to have radiation, the dental examination is a lot different than a dental examination that would be for a healthy person that's not going to have radiation. A dentist's hat is to save all the teeth we possibly can. But in radiation, you have permanent changes to the bone. So we really have to be a little bit more aggressive in considering what's this tooth's prognosis for the rest of this person's life. And if it's guarded or if we have concerns, then we might advocate for an extraction in a patient who, if they weren't having radiation, we wouldn't. And the main thing that we're really trying to prevent is this outcome called osteoradionecrosis. And because I have this slide, before I go to the next slide to share more about osteoradionecrosis and the oral health sequelae, the multidisciplinary team of the cancer patient is extremely important. So cancer treatment, the prognosis, it's so important that it be done in a timely manner, which requires multiple different people to collaborate. And so if you're interested in ENT, you're interested in medical oncology, you're interested in radiation oncology, you're interested in speech pathology, you're interested in nutrition, you're interested in social work, all these people are so important to make sure that we optimize this person's treatment plan and their timeline. A lot of delays happen because of, especially in rural areas when people are all scattered out. So when we think about radiation attributable oral health sequelae, what I mean by this is what impacts of radiation have to normal tissues that then result in negative consequences to the patient. So the first one is hyposalivation, and that happens when you have damage to the salivary glands. We often think parotid glands. They're superficially located and they can get damaged quite easily, especially if they're in the path of radiation. So that's more results in objective changes in the amount of saliva that's produced, where xerostomia is a subjective measurement of the patient's dry mouth. And combined together, hyposalivation and xerostomia, it's like starting a domino if you've played dominoes, where then the low saliva can impact the tissue to cause a lot of frictional problems where they're having, if they were a person that was trying to wear dentures, that can be quite uncomfortable. But it also is very strongly associated with dental decay, because your saliva is so important to help clean your teeth, to help be part of the remineralization process. And without it, especially if the radiation impacted your saliva so that you have a low pH and highly acidic environment, then that can really set you up for dental decay and infections such as fungal infections. The next word we have here is oral mucositis, which is inflammation of the oral tissue, which is very common during radiation therapy. So a patient that's getting their tissue radiated, it starts kind of red, and then it can get ulcerated, and then it gets so painful that they can't eat. And the next phase is that they get so painful, they can't eat or drink, which is severe. And if they can't eat or drink, if you're not getting adequate nutrition, that actually it increases the severity. It's likely to increase the severity of your mucositis. So it's kind of a negative cycle there. And it get really problematic if a person has such bad mucositis that some institutions might stop treatment, and that's associated with a worse outcome if you pause your treatment and then restart it later, which it seems pretty reasonable to understand why that might be the case. And sometimes in order to mitigate and get people nutrition, some places will use like feeding tubes. But there's some studies that show if you put a feeding tube like into your stomach, and if you're not using the swallowing muscles, you can have problems then, you don't use it, you lose it kind of thing. So that would be concerning. And the next words that we have down a little bit down the list is dysphagia, which is difficulty swallowing. So if you have problems with your swallowing muscles from not using them, or because your mouth is really dry, or because the radiation's damaged them, and that could cause, if people are trying to swallow when they're not functioning very well, they can feel like they're choking. So we have oral facial pain is one thing on the list that oral mucositis often causes, but oral facial pain can also be associated with direct radiation injury, and also later down the road if there was some nerve damage along the way. Trismus is when your mouth can't open all the way. So in the acute setting, when your muscles get inflamed and there's a lot of fluid buildup, that could be temporary. But if they get damaged, then later down the road, they can fibrose, which is very problematic, because if your jaw fibrosis down, like it's most of your muscles fibrose down, so you can't open your mouth all the way, which impacts your ability to do a lot, right? Clean your teeth, eat, speak. And if we were trying to do dentistry with a closed mouth, that's very problematic. And then for fibrosis, if you have fibrosis and you try to do surgery to release it, then you cause, when it's healing, more fibers to fibrose. So that, it's really challenging. So in order to reduce trismus for people, we really want to get them to exercise their jaws. And when people are undergoing all of these things, there's so much on their mind, it's exhausting. So we really want to be there to help them, to support them, and so that it doesn't feel so cumbersome. The last thing on the list is the osteoradiocrosis. So if you think of necrosis, we think death. Osteo is bone, and then the radio is associated with the radiation. So bone death associated with radiation. On this slide, I have the mandible lit up. And the reason why is because that's usually where we'll see osteoradiocrosis. And the reason that is because the mandible has a lot less vascular than the top jaw, which is the maxilla. And often if you get radiation to the base of the tongue, that you're going to hit a lot of radiation in that area. So that's the area that we often, if a person develops osteoradiocrosis, that would be where it would be located. Thankfully, it's less prevalent now. We think it's kind of hard to know. And our team is looking at imaging modalities to use in order to see if we can see bony changes earlier, because right now a lot of diagnostic criteria depends on clinical examination, which usually means that we're finding osteonecrosis late, and then it might be more challenging to treat. So we want to see bony changes earlier. And we think that osteoradiocrosis is associated with not having enough blood supply. And if you think about cells that could be used to regenerate any tissues, we think that those get lost in the area of high radiation. So if we can catch it earlier, there are some treatment modalities that are currently still controversial, which is putting a whole bunch of oxygen and hyperbaric oxygen to the area, or there's a newer medication. It's not a newer medication, but it's more used for this reason, as pentoxifylline and vitamin E, and that's to try to help promote blood flow to the area. But still, this is the area of we really want to try to prevent osteoradiocrosis because it's really, really hard to manage once developed. the best way to prevent these radiation toxicities, to prevent the cancer from developing in the first place. So the HPV vaccine, it's targeted or recommended for young people. The reason for that is because, one, HPV is ubiquitous. It's very common for people to get it throughout their life. Not everyone that gets it, a lot of them, your immune system can clear it on its own. And it's believed that it can be in your system for decades before you develop cancer. So the reason why this vaccine is recommended for people early in their life is to try to give it to them before they're exposed to HPV, and at a time where their immune system can develop an immune response, like a robust immune response to the vaccine. So it's thought to be less effective if you get it later on in your life. So if you're not looking to do oral medicine, but you're in pediatrics or you're in internal medicine, this might be an important conversation. And some dentists, I believe, are allowed to provide this vaccine, and that's something that's being in the works, is to try to get most dental practices to be allowed to provide this vaccine, since it is one of the best ways to prevent oral cancer, which is a significant thing to have. And HPV is also associated with cervical cancer, penile cancer, anal cancer. So it's not just oropharyngeal cancer that we would be preventing. Again, looking back at this table of contents, I wanted to just briefly mention some things. So you're like, that's too much to handle. I don't really want to focus on cancer. All right, that's perfectly fine. And I wouldn't blame you, because it does get a little bit complex. So I want to share with you some other things to consider if you were interested in doing oral medicine. So one disease that we often worked up in the clinic in my residency was Sjogren's syndrome, which is an autoimmune disease, and it often attacks the lacrimal glands and the salivary glands. So this person would come in with dry eyes, dry mouth. Some people come in with fatigue. They can be referred from their rheumatologist if they had laboratory results that were consistent with Sjogren's syndrome. And if they came to our clinic, we'd be testing their tears to see how much tear production they had. We were testing their saliva. And if they qualified for criteria, there's a minor salivary gland biopsy that we can actually send to the pathologist to look to see how many immune cells are infiltrating their minor salivary glands to be suggestive of Sjogren's syndrome. Other autoimmune diseases, lupus actually has some oral manifestations. They have lesions that might come into the mouth. And then the other lesions that I mentioned, oral lichen planus, are thought to be an autoimmune condition. Oral facial pain, I mentioned this person here. So if you're having pain, you feel it here, it could be clenching and grinding. If you've been told you do that, it's been extremely common this past few years. And if you feel like you have dental pain, sometimes the muscles, the masseter muscle can refer to your back molar. So sometimes people come in and they think they have dental pain, but it's muscular pain. But of course, if you grind and you clench your teeth, you could have fractures of your teeth. When I was in the military, sick call used to be full of people that would come in with sinusitis, and they would think it was their teeth and their top teeth that were causing them pain. So it's our goal to really investigate where's the true source of this pain before we intervene. And then the oral lesions here. So when it comes to oral manifestations of systemic diseases, some oral lesions can be associated. If a person comes in with a Kaposi sarcoma, for example, well, that person may have undiagnosed HIV, which we can help them to get appropriate lab workup and be sent to an individual, make sure that they're tied in with an internist to help work them up. If a person comes in with oral ulcerations, say they've never had them before, another adult with ulcerations, well, I would start asking them about their gut, their GI system, their stool. Like, is this a manifestation of a GI problem? And then for the tongue, we can have traumatic lesions that the area there looks like that person bit it. However, that benign appearing lesion could be cancer. So we always want to make sure that we're getting a history and that we're palpating, and oral lesions are a large part of the oral medicine training program. The medically complex patient. So this is when you are a dentist in the hospital and you're seeing people that have conditions that are deemed to be a little bit unsafe to be seen in an outpatient dental clinic. So people that we're seeing in the hospital setting would be people who they came in and they're going to have a cardiac valve replaced. And there are some bacteria in the mouth that actually might cause endocarditis on the mitral valve. And the cardiac surgeon doesn't want to go in there, replace the valve if they still have teeth that contribute to infecting a new valve. One person I treated for third molar extractions, he had hemophilia. So we worked with his hematologist in order to make sure that he had the appropriate transfusions and was followed up. He stayed overnight to make sure he didn't have any bleeding issues after his surgery. So there's a lot of different situations. A lot of the medically complex patients that we see are pre-cancer treatment patients. So it's a nice resource to have. And I also think of the people who I don't treat now, but are often seen in the hospital-based setting, are patients with disabilities who may not be able to communicate, who may need to be seen in the operating room for their dental procedures. So the job board is, the world is your oyster. I think of oral medicine, when I think of my colleagues, we're all really spread out and doing different things according to the niche focus that interested us the most. And in addition to my research position here, I'm also a professional leadership coach within my institution. So if you go to an institution that's really robust and has leadership training, you can really create the path that interests you the most. And I mentioned earlier, to make sure, to prevent burnout, we want to make sure our interests are, I wouldn't say balanced per se, but not so narrow focused that we can get burnout on doing something that maybe we even love. So really think about what would be your ideal day, what really excites you. And if you are like me in the beginning, I was really boxing myself into the traditional path. And I think, like your innovation of having this virtual shadowing, I think over these past few years, we've all learned to be a little bit more innovative, and you can definitely do that with your career. So again, thank you so much for having me. Sorry for Reese, of course, but thank you for unofficially inviting him as well. And I would like to make sure we have time for any questions. And again, if you're interested, feel free to check out the other community that we have for you, which is, again, just my name for my YouTube channel, and you'll recognize us because we will be there too. And my email is shown there at the bottom if you have any questions.
Thank you so much, Rigert, Dr. Rigert, for all of that. It's really helpful for students also in the future. If anyone wants to get in contact with you, it's really helpful to have your contact. We really, really appreciate that for any questions. But just to kick it off, our first question was about your outside pursuits. You mentioned a YouTube channel, your blog. How did you find that fulfilling alongside your work as a researcher?
Yeah, so the blogs that I'm on are Kevin MD is one thing that a lot of people use for healing. And before I started writing for that blog, I used to write a lot for kind of like a therapy. And I was holding so much guilt and shame about my career pivot that I was really kind of living in secret, and I just felt really shame all the time. And one day, I don't know what really motivated me, but I was just like, what, I'm going to put anything that I've ever felt embarrassed, shame, guilt about, and I'm just going to write it and put it out there. And I'm a Brene Brown fan. I have a cup here. It says, "What would Brene Brown do?" And it was all about vulnerability. And vulnerability is a very important aspect of connection with people. And we're often taught to be more like robots and to present and save face. And I found, so when I was in residency, there was one attending who told me that she was feeling the same way I was, one attending. And that saved my life, because I was like, I'm not alone. Like, I'm not alone. I need sleep. And so when I shared my story on Kevin MD, I had no idea what to expect. And it brought a community to me that reinforced the need for us to share these personal stories in a vulnerable way, because people were in so much pain. And if we don't share these stories and tell people, hey, me too, I was, as I mentioned, I was having suicidal thoughts, and I thought I was all alone. And I didn't want other people to think that they were all alone, and that I'm much better now. And there's light on the other side, and we just need to rest and give ourselves permission to be human and acknowledge that something needs to change. And then for YouTube, that community has been very fulfilling, because I get the opportunity to meet people who I met through my writing, who have stories that they really want to share. A lot of them got into coaching, but a lot of them resonated with, hey, I did this whole career path for external reasons, either societal pressures parental pressures or anything. And we create this community of just sharing and humanizing aspects of our journey. And that support has been a wonderful community.
Outside of oral medicine, were there any other specialties that you were considering going into, just deciding on them?
Yeah, so I started in oral maxillofacial surgery. And when I was in dental school, I liked pathology. When I was in medical school, so I ended up being more medically, like I was like, I feel I kind of lean more on the medical side. So I was interested in psychiatry and internal medicine, but I realize it's more of the quality of life. I really want people that have improved their quality of life and bring the human back into healing. So during medical school, there was a family medicine physician who his main purpose was to sit with stage 4 cancer patients and say, how can I best support you? Because often during vulnerable times where we're at the end of our life and we don't have solutions to help people to overcome their disease. For me, when I was dealing with anorexia, I was often left alone. I was very, very ill, and no one, like, well, I don't know what to do. Like, so I was left alone, and I didn't want anyone to feel that burden of being alone. So my whole interest isn't necessarily about a specialty, but what role can I play in a patient's life? My role as an oral medicine physician is to hold space for people, to counsel them during very challenging times. And you can do that in multiple different specialties. The difference between how I could do it as an oral medicine physician versus an oral surgeon is that the oral surgeon required me to be a lot more in the OR. And I found I needed to be a lot more with the patients. And I needed a lot more time to just be present. And that's where you kind of have to balance out what's best for you and where your values lie. I would say I love the OR. I just, the amount of, you also have to balance with the sacrifices. The same thing goes with if people are thinking military. A recruiter will tell you all the things that are great. I always ask, what are the things I need to know I have to be able to manage, such as deployment, such as you're risking your life. So people will do it for the money, but you need to make sure you're considering all aspects of what you go into and say, can I tolerate the negatives? If I could do it all again with surgery, what I hadn't done was, how do I do on days of forced sleeplessness that, I wouldn't have known until I was actually in it.
You have a really great question, kind of just to follow up on that. So a student asks, there's a lot of societal pressure to being X, Y, and Z by the time you're a certain age, especially being in college. What advice would you give to those who feel like we should be farther along in our career for our age, like they don't align with the expectations?
Yeah, I think it's funny because that's like what the whole YouTube channel is about, because I felt a lot of us felt that pressure, and that's where we ended up getting where we didn't want to go. And I was just, a lot of people that I was just at the grocery store, and this person was like, I think I'm going to take a gap year. And the person in front of me was like, yes, do it. Like in adult, like we learned from the pressures on society, like, it's your life. Right. If you take a year to really investigate, I had one resident in oral surgery that took a year sabbatical to travel. And to really, I think, if you are to start dental school because you feel like you need to start it right away, but then it turns out to not be the best fit for you, then you're a lot more than time out of your career trajectory. If you had to take out student loans, they call it the golden handcuffs. And so just remember, it's your life. And I think the humanization of this whole experience with me today, hopefully is kind of showing you by example, is that it gets to a point, I'm 34 now. And if I had to go back and tell myself, I had a lot of pressure to not go into, I was really interested in doing psychology, and now I really love Brene Brown and Adam Grant. I'm like, gosh, I kind of wish I would have just followed my heart. And there's a book called The Way of Integrity by Martha Beck. And it's all about really listening to yourself. So it's a really long way to just say, trust yourself. And even if you have a lot of mentors, so in dental school, I had a lot of mentors telling me what I should do. And I was such a people pleaser that I really was ignoring a lot of my internal cues to say, oh, but I had mentors that knew me really well that said, ooh, for me, like, oh, you could do that, but maybe you shouldn't. And And I think if you get a lot of advice from mentors, that's great. But then go off on your own and say, if social media didn't know what the heck I was doing, if no one ever knew what I was doing, what would I do? And when you were a kid, or like, what do you do for fun? Like when you're given a whole bunch of free time. And I think that kind of points you into where your talents are, where your gifts are, where your interests are, unless you were forced into those hobbies by somebody else.
Just to clarify the traditional path for oral medicine. So is it dental school first, medical school first? Does it vary from one person to another?
So it's dental school. It's unique to have, the reason I have a medical degree is because I was in oral surgery. So for oral surgery, there's a 4-year track that doesn't include medical school. There's a 6-year track that does include medical school. For oral medicine, typically you don't get your medical degree. It is dental school and then oral medicine. And oral medicine can be a certification or a master's in oral medicine, depending on what program that you go to.
Got it. All right. So you chose research for your route, right? You mentioned a few others. Why was it research that attracts you? And for the other colleagues who are in other fields, what are the motivating factors for them going in, like, let's say, academic institutions as faculty?
I think a lot of us like to teach when it comes to faculty positions and collaborate with people. It's really nice to have an institution that's you can collaborate. For research, for me, I saw a lot of gaps, unmet needs, especially when I was seeing patients and they were coming to me and I didn't have a lot of things I could offer them. So there's this big circle of gap when it comes to patient comes in with damage to their salivary glands, dryness of their mouth, and I can't offer them anything. So in order to get time, in order to devote myself to solving these problems, I really wanted to devote my whole career to it. So I get to choose what projects are most meaningful and feel the most needed. And depending on what route you go, a lot of people do research and clinical, and depending on how much research funding, it protects your time. So you can do clinical, and your research amount can be a lot different depending on your path. People in academia teaching it's expected that you do research. You also have a lot of other roles that you have to play. And for me, it's a little bit more challenging because I tend to throw myself into things pretty deeply. Though I do have multiple different roles. So I'm a research fellow, I'm a coach, and then I'm a school in the biomedical informatics. I'm a student in the biomedical informatics school for a certification in dental informatics. So that was a long way to say, I really felt that research is the best way to investigate problems that we know have unmet needs in terms of solutions.
Yeah, it's good to see also a variety there of things that you can do.
Yeah, definitely.
Another question we have is, because it is a developing field, somewhat new compared to the counterpart, the surgery counterpart, are new providers in oral medicine limited to certain locations because those specific locations are just acclimated to have oral medicine providers? Is there any limit?
I think that we really need to just educate people about our existence. So oral medicine as a residency, they've been around for a long time. And I think they just hadn't been accredited yet as a specialty, because it's expected that you learn dentistry and medicine, but there's not enough time in dental school to learn all medicine. And when I was in medical school, we didn't look at the mouth. And so we need to teach people that we exist. And I think you can start to carve your own path. For me, I was a faculty member at a different institution before I came here. This role that I have now didn't exist. My boss is amazing, and he's got a lot of great ideas, and he's innovative, and you need somebody to take a chance. And that's where the change is going to be happening, right? We just need to carve it out for ourselves, and we need to say, this is what I can offer to this institution. And you want one that's going to support you in it and support your vision. And also, when I think about regions and when you think about residency, I think a lot of people often recommend, to make sure that you're not only looking at the prestige of the name of the institution, but Are you going to be living in an area that you can thrive? Because the impact on you is, for a long period of your life. And are the people that you see as your colleagues, are they going to be a good team for you? And to look into those things, and no matter what, residency and your future job.
You mentioned you're part of the Air Force, so I'm sure there's a lot of students out there, or some students at least, who are interested because I know there's some scholarships with different divisions of the military to pay on medical school, dental school, health profession schools in general. Could you talk about the process going through that, how it might differ also from one military branch to another?
Yeah, well, I think it's to set yourself up with a health professions recruiter in your area, and also to talk to people who are in the military right now. So I got out of the military in 2017. It's different from then than it is now. And so if I were to tell you about my experiences per se and the pros and cons, then it's kind of outdated already. And also when you're choosing and you're at a certain age going into medical school or dental school, we're at this age, it's kind of tricky, right? Because I signed a 13-year contract, not knowing I was going to get medically discharged early, but I committed for a really long time. And that was so risky. A person I was dating at the time, he passed away when I was in residency. He did not want to be in the military. And so this decision that you make, some people thrive in the military, some people do not. You risk your life. So when you're looking at the money that you can get, I really wanted to be part of the military. It was something I really wanted, that life. But if it's not, then you can make that money back. Be very strategic with your loans, try to get scholarships. Don't do what I did, be like YOLO when you're in dental school. Just be very smart, get educated on your student loans. If you take some time in order to really decide before you commit, in order to make money, to reduce the amount of loans that you're taking out, but then you risk tuition. So just try to balance all those factors. And when you meet with a recruiter, again, ask like, not only the benefits, but tell me more about the negatives. What do people say they have to really keep in mind? Which would be moving all the time. Some people love it. I liked it. But deployments and risking your life.
And it is somewhat of a selective program. So how do they filter out people? What are they looking for in an applicant? Is it just the enthusiasm to be in the military or dedication?
No, they look at grades. They looked at grades. It was like a regular academic kind of application. And then you also have to factor in so I would say separate from civilian applications, they're factoring in so I ran marathons. I was very fit when I applied, and that was a pro for me. And they're going to look at service, and they're going to look at your reasons why you want to join the military. So it's a very inclusive, I would consider it kind of similar to your medical applications, your dental applications.
And right now, what does a typical day look like for you?
Well, I work with COVID. We did a lot of remote work. So since I work with radiation oncology, I work with a lot of imaging. And so I have the opportunity to work all remote. And advancing in my career, we have an oral oncology clinic and opportunity to advance into clinic, though I'm not in clinic right now. And if I were to share compared to where I was when COVID hit, I was a full-time clinical faculty member. So it went from relatively full-time clinic to all remote research. Also,
another thing about your YouTube channel, what was the process of starting that up? How did you navigate like a certain niche to what you would talk about?
Yeah, so I have always been a watcher of YouTube. So I kind of had an idea of what value I wanted to bring, which was I used to watch people for the community that they created and their authenticity. And when I wrote, I felt it's all kind of in the similar theme. So I have a Facebook group called Permission to Pivot. And my YouTube channel was kind of in alignment with that. It's really kind of to the question that you asked earlier. How do we fight back against or embrace what we want to do, even if it's not societal expectations and it feels like I'm a unicorn? I really wanted people to have a community to explore that together. And so because it was my authentic vision and what I thought I could add most value, that's how I created the niche. And I feel fortunate to have it's barely about me. I interview a lot of different guests. So I did do some recording about my transition out of oral surgery, but the most of it is me talking to guests about their life. And it's really great to hear about people, and it constantly puts my life into perspective.
And then one last question, going back to what you mentioned about burnout, do you feel like in order to really best deal with it, is it something that's individual or is it something that's more generalizable? Like when I say that, I mean, can you completely prevent it, or is it something that's inevitable? Is it something that you need to figure out how you respond to before you can actually deal with it well?
I think burnout's tricky because some people say burnout's related to moral injury. So moral injury is when we're in a healthcare system that really dehumanizes. And if I think about moral injury, it's actually a term I was familiar with from PTSD workups in the military. It's doing something that's not in alignment with what you feel is in the best interest of humanity. And so I would explore a person on a very individual basis where their sense of burnout is truly stemming from in order to target a solution on their best next steps. And so I think, a lot of the generalizable risk factors that we're all going into when it comes to healthcare is that a lot of access to care depends on your pocket size. And that to me is a very big problem. It was very hard in dental school when I would offer a treatment plan, people couldn't afford it. And I was like angry inside because I'm like, this is not fair to say a person I have to treat somebody less than because of their financial resources. And that was one component of why I was so eager to join the military. So I didn't have to be constantly bombarded about, we just recommend a treatment plan and do it for when you're active duty in the military. Of course, then you get moral injury from going, and other reasons. But when it comes to burnout, so what I was facing in oral surgery, a lot of sleep deprivation, and something that we don't do well is setting boundaries for ourselves, giving ourselves permission and really prioritizing. There's a lot of times we talk about, we don't even give ourselves permission to pee. We don't often eat. We often neglect our basic needs. And I think that we just need to bring the human back into healthcare for everybody, for the patients and for every single person that's involved, from admin to the clinicians to everybody that's involved.
Absolutely. All right. Well, I think that's a great place to land off today's session. Thank you again so much, Dr. Rigert. I do have a few reminders for our shadowers out there. So if you are new, we have a quiz where you can earn credit for your attendance by completing it and passing it with at least 6 out of the 10 questions, or 60%. You'll receive a certificate. That certificate will be sent to the email that you list on the quiz. So be sure it's an email that you frequently use. We really suggest using a personal email, a Gmail, Yahoo account, because sometimes school emails filter things out. That quiz is now posted in the chat box. It's also available on our website. So check out either on our website. If you go under the virtual shouting page, we have 2 quizzes available, since again, there's 2 sessions usually each week, and you can complete the one marked for Thursday. This quiz will be due next week on Wednesday, October 12th at 11:59 p.m. Central Standard Time. Like I said, this quiz will be, the certificate, if you do pass, will be sent to the inbox of the email address that you list. But just in case, let's say it doesn't go through to your inbox, please check your spam folder, or feel free to send us an email just in case it doesn't happen to be there either. For our next shouting session, it's going to be on Monday with Van. He is another PA. We had a PA earlier this week on Monday. And he practices in general orthopedics and sports medicine. He got his master's of science in physician assistant studies from Touro College. So we're excited to see him next week. And he'll be with us at 7 p.m. Central on Monday, October 10th. Like I said at the beginning, if you want to stay tuned with us for any sessions, really, feel free to either join our listserv or keep an eye on our Instagram page. Both are great ways to keep in touch. And Dr. Rigert also has her email, her YouTube channel, her Instagram page. If you want to pull that up from your slide set.
Yeah, let's see. Let's see if I can do this. It's always tricky with technology. Y'all have witnessed a few times, but that's okay. We'll get up the YouTube channel, and the email is in the bottom right-hand corner. And then Jillian DMD and Reese DOG, I think, is my Instagram name.
Perfect. Well, thank you again so much, Dr. Rigert, for all of this. If anyone wants to reach out to her, feel free to contact her email. Give a few of her videos a watch for sure. I'm sure that there's a lot more that I wish we could have talked about within the hour. It went by so fast, honestly. I wish we had a little more time. But yes, definitely feel free to either reach out or check out her YouTube channel. I'm sure there's a lot of great insight to go over there. But yeah, that's all for this week. So we will see everyone next week. And we thank you all for joining us today. It was great to see you, Dr. Rigert.
Yeah, thank you so much for having me. And thank you everyone for being here.
All right, take care.